The pandemic and its resultant lockdown was a difficult time for many. There was loss of job, there was loss of opportunity, and there were loss of loved ones, and a lot of changes. But for some, this loss was a little more profound than the ones that we talked about. For them, it was a loss of an opportunity to connect, loss of an opportunity to be heard, and loss of the tiny thread that they were hanging by to live. Yes, welcome to the pandemic within the pandemic, the mental health crisis and the lockdown. And that is what we are going to talk about. As I delve further, I want to bring to your notice a 75-year-old longitudinal study that was done to find out the answers to what we've all been seeking answers to. What is the secret and what is the source of happiness and satisfaction? And it wasn't money, fame, cars, apartments, bungalows, houses, a pool in your house, a jacuzzi in your house. No. It was one rather simple thing. It was social connect. Yes. People who had fulfilling relationships with their family, friends, and the community reported much more happiness and satisfaction as they neared the end of their lives. And if you notice, these were the foundations and the basics that we were denied of during the pandemic. So you can imagine how the situation must be for those who were already finding it difficult to cope with these situations. Social connect is critical to mental health. In India, the face of mental health has started to show face in newspaper headlines. Headlines which said something on the lines of 300 COVID-19 related deaths attributed to suicide. A lot of research done by Indian researchers pointed out that anxiety, depression, anger, denial, grief, insomnia, and a few more were one of the top concerns that the country was dealing with apart from the virus. It was mandated by the government of India to have helplines in schools and colleges to cater to the concerns and the anxieties of students who had missed their examinations and other personal concerns that they might be dealing with owing to the fact that they were all locked up in one house. NGOs, community helpers, all saw a massive increase in the number of calls that were made to them, in the number of help emails that were sent to them, in the number of people who tried to reach out to them. The mental health professionals, psychiatrists, therapists, psychologists saw a massive increase in the number of clientele that sought their services. But you may wonder, who are these people? Who are these people who went through all of this? You don't have to look far. These people are not a group of people staying somewhere or far there lying. No. These are people just like you and me. These people are your children. These people are your spouses. These people are your colleagues. These people are your neighbors. And in some cases, these people are us. And we try to reach out to all of these services and help within these tough times. And there were people around you who were reaching out. As you listen to me speaking and as you see me talk, you may not be aware of the kind of difference that you make in people's lives. You may not be aware of how grateful some people are right now that they have you in their life. And vice versa. I'm sure there are some people that come to your mind who you are so grateful that are there in your life. And we are not talking about anything substantial or big. These people are people who are looking forward to an interaction with you. These people are people who are looking forward to just seeing you, to just making eye contact with you, to making small talk with you. That's all. It's us and these people who form the environment in which each one of us thrive or die in. And therefore, it becomes all the more imperative that we understand the importance of mental health concerns. We understand the importance of advocating for mental health, speaking out loud and encouraging others to speak out loud too. It was a rot that was brimming and which finally burst with some strain and some stress. And I hope that when we return to our new normal, we do not forget these learnings. Not at all. We cannot afford to, especially not now. And I want all of you, after whatever we have heard, seen, and maybe experienced, to be champions of mental health and to realize the importance of how necessary it is to talk about it, how necessary it is to realize it. And we are not talking about something extremely big or a certain training. If you can, great. For those of you who wonder and who want to go a little more deep and wonder who these people are, excuse me, and who wonder where can we find and how can we help, I just want to say one simple thing. Just ask. Just ask. But don't stop there. Ask and listen. Listen not to respond, but listen to connect. As I near the end of my talk, I was instructed to make this talk very inspiring. I think I want to tweak that a little bit, and I think there's a little bit of change that we can bring in over here. I don't think after whatever we have gone through, we can look at inspiration from anyone else and from anything else. This time, the inspiration is us. This time, the inspiration is you and me. Me for myself. It's not, you don't have to look up to somebody, you don't have to look up to something. Inspiration and ideas lie within us. They lay within us during these times, and they will forever lie within us. And I want us to hone the ideas and the inspiration that we already have to take us to new heights for motives that are extremely important for all of us. Thank you.